Hi, everyone. Welcome to MGFA's Wellness Series webinar, Navigating the Holidays with Minimal Stress. I'm Jenna Umvalo. I'm going to be moderating today's talk. Before we get started, I want to go over a couple of housekeeping items. If you have any questions, they'll be answered during the Q&A segment. You can put them in the Q&A box located at the bottom of the Zoom menu bar. I wanted to give a special thanks to our sponsors, Alexion, Argenx, Janssen, and UCB. And with that, I want to hand it over to our presenter today, Deena Rodney.
Good afternoon, everybody. Thank you so much for joining us. This is actually my first presentation with the Myasthenia Gravis Foundation, so I'm so excited to be here with all of you. This is what we were just talking about, kind of like a little bit of a soft talk to kind of round out the end of the year. And I love doing patient programs and so excited because the best part about doing patient programs is that I actually get to learn from you guys. So I'm really interested in hearing your feedback. And after you've listened to my pearls of knowledge here of ways that you individually have found ways to navigate the holidays or how you feel. So it's important to remember through this whole presentation that we are all individual here. We all have our own special, very unique needs, and this is a generalized topic. And as we go through the questions and answer parts, that's when we can get really specific and individualized from you all. So let's enjoy our holidays, and let's bring some quality of life back to all of our lives and learn how to navigate the holidays with minimal stress. Ways that I think that we can do that and navigating the holidays are big questions that have been coming up for the last year or the last 2 years. So how do we, or are we going to holiday after social distancing? Does that feel right to you? How do you feel about this? Is it something that you're concerned about? Have you talked to your families and your friends about this? How do I manage my myasthenia gravis during the holidays? Am I able to make room for new traditions for the new me that are consistent with your values and the need for your medical care? Am I able to travel with my myasthenia gravis? And most importantly, the goals on navigating through the holiday, which is empowering you to enjoy and maximize the holidays and improving your quality of life. So I think we start off by doing this by sitting down, taking a moment for yourself, having a little bit of mindfulness, and setting realistic expectations for yourself. It becomes too fast that the year, the months, the days just kind of pass us by. And I find that it's very important for us to sit down and discover the new you, the new us. How are we different today than we were yesterday, and how do we want to be different tomorrow? So setting enjoyable expectations are crucial for you to enjoy the day and to be in the moment. Give yourself permission to be present with every activity you do. Don't feel that you're taking a bird's eye view. Be in the moment, be in the conversation, enjoy your environment, whether that's just being there, having a conversation, or enjoying meals and foods that you feel are right for you. What does the holiday season mean to you? Sit down, take a book, take a moment, sleep on it, and set these goals. Set them with yourself, set them with your providers, set them with your family and friends. Does that mean that we facilitate conversations prior to going into the family events? How do we achieve the big question of setting realistic expectations? How do we achieve being in the moment? And that is the big question here on how we work on enjoying our holidays. Next slide. So it is okay. It is okay not to say yes, and that does not necessarily mean no. It is okay to say, I have to, or I might need to leave early. It's okay to say, not this year, maybe next year. It is okay to offer a substitute, such as, can we meet virtually? Or is it possible that we do this celebration at a different time or even a different day? In healthcare, there are many, many times and many years that I have actually celebrated holidays on non-holiday days because we were working or on call, and it was actually more enjoyable than trying to push everything in to one day when our schedules didn't fit that, or we were too fatigued or too tired to actually enjoy the event. And it is important to ask, can you help me? It is okay to ask for help. Next slide. So first and foremost, everybody's getting together, you're getting invites for gatherings or parties, or possibly you're the one that's going to host this. So how do we do this so that it meets your needs? And it could be that timing actually is everything. Do you find with your myasthenia that your symptoms are better controlled in the morning, afternoon, or in the evening? This is something that you really need to think about. And you need to work on a plan to kind of manage that, because enjoying and being in the moment may not be the classic time that everybody else wants to do the celebration. It might be the time of the day that medications are best maximized for you, or the time of the day where you have the least amount of symptoms. It's everybody that's different, and some days that's different for everybody, but picking and choosing the best time could actually improve these moments for you. Do you still want to do these gatherings or parties virtually? You can do religious ceremonies virtually. You could actually do some gift exchange and gift opening virtually, although we know that we did this last year and everybody probably wants to move away from that. It's still an opportunity. We've kind of gotten good at the virtual environment, and it might be something that you still want to manage with a larger group of individuals. And again, thinking about alternate schedules that might work better for you, for your medications, and for your symptoms. Next slide. So lights, camera, action. It's actually party time. How do we get ready for a gathering or a party when you are already feeling fatigued or somewhat symptomatic in the day? There are many resources that are available to you depending on what your symptoms are, including your activities of daily living. Is it very difficult for you to manage your hair? You can possibly make appointments for people to do your hair for you. Do you have double vision, diplopia early in the morning or in the evening, or is night driving very difficult for you? Consider scheduling a driver for you that might be able to take you home from these parties if you're feeling like your symptoms are not well after an hour or two of socializing. Potentially have a food delivery service. It doesn't have to be for 100% of the food. I know that could be costly, but 50-50%. Therefore, you are actually not in the kitchen all the time, and you are actually being able to be in the moment. And simplify your decorations, or have people come over and have a decoration party and work on that to get everything ready for you so that you are actually minimizing all the prep time and actually in the moment enjoying the actual party. Next slide. Sharing is caring. Is it though? Not always, right? We know this in the time of COVID, that is very easy to become sick, especially this time of the year when there's other common things that are very prevalent. So we always want to remember infection prevention. Make sure you're up to date on all your vaccines. This can include your COVID, influenza, pneumovax, meningococcal, etc. I do want to say that this is not medical advice, what I'm saying here for the vaccines. If you have questions on any vaccines, I do highly encourage you to make appointments with your provider. These are only to prompt for questions that you may have with your provider, but not intended for medical advice. Make sure you continue to keep your mask on you. You could get a festive mask to make a little bit more fun if you're getting a little bit of mask fatigue like everybody else, or feel a little intimidated because everybody has gotten mask fatigue and dropped it. Include that as part of your fun accessory to make sure that you're keeping yourself safe. And then also, if individuals are telling you, or if they notice that they are not feeling good, it is okay to tell them that they should be going home and not spreading any potential illness. That is not rude, that is keeping yourself safe. And then another little tidbit is bring your own reusable utensils. It's not only sanitary, but it's environmentally friendly. So it's a win-win here. Easily you can buy online reusable, environmental friendly straws, utensils, foldable cups. Therefore, there's not a lot of individuals who are touching your stuff, and it's only known by you, and you're able to make sure everything is sanitary. Next slide. Managing your diet. Obviously, we know this is always a struggle for all of us during the holidays. Has medication may actually, certain medications increase appetite. Maybe this has already happened to you. Potentially, you've already had some weight gain that has occurred because of the medications you're requiring to keep your symptoms under control. So, how do we manage that? We want to make sure that we stay on a routine with our meals. We want to make sure that we snack throughout the day before we're getting ready for the big party. So, snacking can actually reduce the urge for seconds or even thirds that we like to pull off when we go to parties, and foods that we don't eat very often. Please try not to skip meals to prepare for the main event. Number one, that could cause some chewing muscle fatigue and swallowing fatigue with you, but also add to increased weight. And then offer meal suggestions, possibly if anybody's having a type of party where you're having a potluck, you can offer suggestions of meals that would be easy for you if you're having any difficulty with excessive chewing or any type of swallowing like dysphagia. Offer suggestions that would be easy for you and that you would enjoy to help you be in the moment. And of course, we cannot forget to exercise, and that includes just reduction of stress for the holidays. So this is not hard cardio. We're talking about just stretching and exercising and keeping ourselves healthy and our respiratory tract well with doing mindfulness activities such as yoga or just easy stretching in the morning. Next slide. Other ways to reduce stress are finding new traditions for yourself, your family, and friends. Some suggestions might be to help conserve energy, a tree decorating night. Invite some friends and family over. That way, the stress is not all on you or you and one other person, but you can actually make an activity out of it. You can do a cookie night. Therefore, you're not responsible for all the desserts, or a cookie swap where you make one batch and you trade with other people. And you can even have a pajama party or breakfast. Is it particularly difficult for you to get up and dressed? Turn that event into something that's not so fancy, but turn it into something fun. It's easy and comfortable to wear pajamas. Make that a new tradition for you if that's something that you feel challenged with. Next slide. Medical appointments. What do you need to prepare for approaching the holidays? We know that the provider offices all get very busy during the holiday time. Some of the offices are closed. So it's really important to make this preparation prior to the holiday season. You want to make sure that you have all of your refills taken care of, especially if you're going to be traveling for an extended period of time or out of state. Check with your insurance policy, see how early you can refill medications. Sometimes you can refill them 25 days instead of 30 days. Talk to your provider, talk to your insurance company to make sure that you don't fall short when offices are closed or when you're actually traveling. Do you need a note for travel? Do you want your provider to write a note saying that you actually need to travel with medication on you? Consider that to be an option. And then for any last minute changes that you might have, if you're going to be traveling out of town or the office is going to be closed for a prolonged period of time, you might want to just schedule a routine visit, even though it's outside of your normal routine visit, to do an examination, talk about your symptoms so that there's any new symptoms that are showing up, there's changes that can be made prior to office being closed or to you traveling out of town. Make sure you have your medical ID bracelet on you, stating what conditions that you have, and make sure you keep handy, and those that you're traveling with that you have in handy with you, a do not take medication list. The MGFA actually has this listed on their website. There are certain medications that you should not be taken during a time. Common colds, there's certain medications that you cannot be taking. So this medication list should always be handy, and always resource your provider or a pharmacist if you have any questions. And then questions to think about: are you on any infusions? Are you going to miss an infusion while you're traveling? Do you need a case manager or your provider's office to help set you up with an infusion? A lot of infusions can be given in different states while you're traveling. We just need to prepare for that, but that is an option. So traveling is an option even if you are receiving infusions. Next slide. Trains, planes, and automobiles. So are you taking any of these for any of your travel, and how do you need to work around this to reduce stress? If you're doing long car rides, making sure that double vision, ptosis, drooping of your eyelids is not going to be an issue for you. You want to plan to make sure you have enough stops that are around the time that you take your medication to optimize the use of your medication hours when they're working. If you're going to be in an airport, reserve a wheelchair or a shuttle transport to conserve your energy so you're not carrying a lot of luggage with you and a lot of fatigue with extra steps that you might be needing to take. Make sure you carry your medication on your carry-on bag with you, and bring a small healthy snack with some fluids with you in case you need to take your medication while you're actually on the plane or on the road. And make sure you stay well hydrated. We know that dehydration can actually exacerbate some of your symptoms. So do not miss your meals and stay hydrated. Seasonal stress. We know seasonal stress is a very real thing. It can happen for many reasons, either disruptive schedules because of longer days, you're waking up early in preparation, you're staying out later during social events. You can also have some financial strain with medical bills. Ways to get around this is by utilizing medication savings programs that are commercial saving programs, or even calling some of the pharmaceutical companies to see if they have any programs that are available for you. If you have or have not had, look into FSA accounts to utilize that towards the end of the year if you've hit your donut hole. And then also other ways to reduce seasonal stress are crucial conversations. Do you have them or not? Do you tell family members if a diagnosis is new to you that you have myasthenia gravis? Think about that, and think about a time that you might want to tell them that. You might want to plan ahead for that to reduce a stressful conversation so you can actually be in the moment. So all of this applies to new diagnoses or those who are having some new symptoms who don't feel stable. And another way to combat seasonal stress, of course, is to find a way of either exercise or meditation to be mindful and to be in the moment. Next slide. Weather. So weather, either extreme temperatures could actually affect or exacerbate your myasthenia symptoms. You want to dress in layers to avoid excessive temperatures. If you're going somewhere cold, make sure you're in layers so that you don't get overheated with excessive layers on you. Bring blankets with you or jackets to make sure that you're not suddenly in an environment that is too cold to exacerbate your symptoms. Many ways that this causes exacerbation is by changes of your respiratory status with cold environments. And then with extreme heats, obviously it could exacerbate and maximize the symptoms that you have with extreme activity intolerance and fatigue. Next slide. Communication is key to help reducing our stress. So again, pre-plan a safe place for discussion if you need to talk about certain meal plans or changing in time, to give enough time for your family members and your friends to plan and to accommodate for you. they want you to be there. They want you to enjoy. So I'm sure they will be very open and welcoming of a conversation, of communication, to let them know what activities and what you can and cannot do for this holiday season. Please be honest with your limitations, be honest with your friends and family, but most important, be honest with yourself. And communication sometimes also means alone time, and that's okay to take a couple steps away from everybody to reduce the stress, reduce the talking, and to just take a moment to be there and mindful for yourself. So slow and steady, plan ahead, make lists for yourself, try not to do too many chores on the same day, allow for rest in between events, whether that means taking a nap or simply just hydrating yourself or sitting down, watching a TV show, and try to keep your routine as best as possible, including meal times, which includes your medication schedule, sleep, and exercise. So ready, set, recovery. Take time for yourself, take naps, conserve your voice, conserve your energy. Set goals for the new year to discuss with your provider on ways that you want to manage your MG and your symptoms. You are empowered to take control of your myasthenia. This is a new year. It's a new you. You have the resources to do that for you. So set your New Year resolutions, take your myasthenia gravis day by day, and sometimes understand that it might be taking it hour by hour. You have choices for your treatments. You have choices for the way you celebrate. You are the best you today. And I want to wish everybody a very happy holiday and a very healthy new year.
Thank you so much for that. We'll go into the Q&A piece right now. I have the first question is about managing MG when it's your first set of holidays being diagnosed with MG. What are some things that you've seen or that you would suggest for newly diagnosed people?
I think the biggest challenge that usually comes with that, and I can certainly open this up for any chat discussion, but is, do I actually tell my friends and family that I've been diagnosed with myasthenia gravis? And clearly, that's a very personal decision that you need to make. I feel strongly that being open and communicating does help empower you. MG is something that is the new you. And all in all, your family and friends do want to help you. So I feel like that is the biggest challenge that most individuals come across is having that communication with a new diagnosis, and also understanding that sometimes they feel that the myasthenia is going to control them. But again, you do have some choices. And if you are struggling with how you're going to manage the holidays and what activities you can do, it is important for you to set up more appointments with your provider to work on getting better control of your symptoms and having true expectations of what day to day can be like with myasthenia.
That's great. Thank you. This next question is, how do you talk with my younger children to help them understand my symptoms?
Mm, that's a very good question because it depends how the children very young can be very young within a couple years, or it could be very young under 10. Very hard for me to say that. So I actually highly recommend working with a therapist, with a counselor that could actually do some type of role play with you to incorporate that. There is a child's book out. It's not branded, it's by one of the pharmaceutical companies, but it has in mind how you talk to your children about myasthenia gravis. It's a cartoon book and it is available. So that is something you might want to talk to your providers about, but there is a book available for that. It's a free book. It might even be on a link on the MGFA. I'm not sure, Jenna, are you familiar with this book or not?
Yeah, I know we posted it on some of our conferences.
Okay.
Let me check if it's on the website too.
Okay. Yeah. So that book is really good. I've read through it myself. I actually have it at my desk to give out to new diagnoses. But I highly encourage working with like a child life specialist specifically if you wanted to do that, because they have ways to help you explain that would be very different coming from like mom, dad, grandma, grandpa, aunt or uncle. Yeah.
Yeah, that's great. Yeah, we'll look and see if we have that one available on the website.
Clara's Talent. That's right.
Oh,
Thank
there
you
we go.
so much. Yes.
The next question is, how do I help my family or caregiver not overprotect me during the holidays?
I mean, that just kind of comes down to communication. I think that's, really lovely that your loved ones are wanting to help you so much. But I understand that you do want to have your own autonomy and independence, and sometimes just forget that you have a chronic disease state. And so, again, it's okay to tell them, I can do this, right? So we did talk about a lot of things that to say I cannot do, and that was probably transparently a fault of mine. But that's a really good question, and this is why I say I learn from you guys all the time. It Excuse me, it's okay to say I can do this. I am okay. I will be okay, and you should tell them that. That's phenomenal.
That's great. Thanks. Um, the next question is, I think things are still up in the air about me having MG, but the mestinon has helped me so much. Prednisone really helped. What can I do now that I'm not on prednisone and only experience the differences for 1 week?
So I think that is, I'm not really sure how to answer that right now, because that's a medical question that I have reservation in being able to answer today. Unfortunately, it's not one of those talks. I'm so glad you're feeling better and so soon, but I'm not able to give medical advice today. If there's a different way that could be asked, I might try to answer it, but I can't give medical advice.
And I think maybe one of the suggestions that we could also give is that if you have medication questions, it's always great to talk with your provider and discuss the options and the ways that you could navigate some of the obstacles you're being faced with. This next one is, what are your suggestions to boost my energy during the holidays? I don't want to bring my family down.
Um, that is something that I think that maximizing your amount of sleep and keeping good nutrition and hydration really helps. I always think that going back to the basics are the way to go with that. So taking it simple and routine. There's no medication that I recommend to boost your energy for myasthenia. I think that if you feel tired, you take a nap. I think that if you if you don't want to bring your family down, again, it's working on setting realistic expectations. So if you have a good 6 hours out of the day that you're feeling really good, encourage them and prompt that conversation and those activities to happen during that time of the day. That way it's kind of a win-win for both. Let's be realistic here. The holidays are tiring for everybody, right? So do not compare yourself even to yourself a year ago. Do not compare yourself to you prior to MG. I cannot manage the holidays like I do. I cannot manage the holidays the same way now as I did 2 years ago, right? There is an aging factor that happens, unfortunately, with all of us. So it's important to just kind of wake up and understand what you can manage within yourself and not compare yourself to anybody else.
That's great. So with traveling and COVID, do you have any suggestions for people when they're dealing with family members who may or may not be vaccinated and you're not sure about their status?
Yeah, I think that's a huge challenge, right? And we get into a big debate here. So I highly recommend for you to follow the CDC, the Center for Disease Control guidelines around those who are not vaccinated. So my only recommendation for that is to follow the guidelines as far as, keeping your distance, staying outside, and if you are ready to have that conversation with them, it's a very transparent, blunt conversation that I would love to be with you during the holidays, but I need to make sure that I and the rest of my, immediate family safe. And in order to do that, we need to make sure that you and I are all vaccinated and we're following CDC guidelines. It's not an easy conversation, but it's a simple conversation, right? The work has kind of been done for you. So washing your hands, keeping a mask on, making sure again that you're not using the same utensils if you choose to do that. Those are all ways to go around that. But you can even every family is different, right? But you can even send them texts or emails on the most updated CDC guidelines if you do not feel comfortable having those conversations and just saying, look, this is what the CDC guidelines are. My provider has told me I should adhere to this. I want to adhere to this for the safety of myself and my family. Please let me know if you have any questions or concerns or if you're not.
Great. Um, and then this is kind of along that same vein. If masking has presented problems in my family, how can you approach that topic? Wearing masks.
You know, I mean, I think that we should not have a mask stigma. I know certain families do, but the reason why you're here today and you're present is because you want to be the best for you. So do not be embarrassed to wear a mask. Protect yourself. In general, they say masks are there to protect others. If you have people who are coming over, I mean, I am a big Pinterest person. Put a basket together, put some cute paper mask, some holiday mask in there, and put it right at the door and put a sign that says, help yourself to a mask. Encourage them without telling them. So empower them to do the right thing as well for you. I mean, it's very easy. You don't want to have the conversation or create conflict with that individual, but we could always put on a chalkboard sign, masks are here, please help yourself to a festive mask, and it could be a mask party. I mean, get kind of creative with it without pulling some conflict away. See who could bring the prettiest, most decorative mask.
I like that idea. I didn't even think about holiday masks. I'll have to look up
Yes,
some.
and they have them. I mean, that's another new tradition too that I didn't even think of, but you could actually have a mask decorating party
Mm-hmm.
with the family.
Yeah, it's great. This next one is, how do we overcome holiday blues and avoid depression this time of year?
Oh, isn't that a challenge always? The holidays are supposed to be the best time of the year, but again, the stress is real. And if you feel that you are prone to, or that you might be starting to develop some changes emotionally that might be causing some anxiety or some depression, then I highly encourage you to make an appointment with your provider. There are resources out there. I think somebody just put on here National Suicide Prevention. That's a great resource. Thank you for that. But talk to your provider. There are certain medications that you can get on to help reduce that. That doesn't mean that you have to be on medication long term. I know that medication can be fatiguing because you're already on medication. But sometimes just talking to somebody could help. So reaching out to your provider, finding resources through a counselor, through medication, through a religious support group, through healthy exercise and maintaining your diet. All of these things help. So there are natural ways to boost our feel-good hormones, which includes simple things like just getting outside and doing some fresh air and stimulating our senses. So there are different variabilities on our level of depression and anxiety. And if you're not sure where you sit or where it might go, that's when you encourage to go to a provider. But that doesn't always put you you down the line of medication. It could be being part of a community and resource, just like the MGFA is, to have other people who understand you, people can hear you, and people who understand what you're going through.
Hmm. This next one is, being an MG patient, I want to exercise, but know I have limitations. What are your thoughts about yoga as a good option?
Well, I think that's a wonderful option, slow and steady. And there's a lot of different yogas that are out there. So, not every yoga is strenuous on your body. Some just offer meditation, some offer deep stretching. So, if you have limitations, start off with one form of yoga or exercise that works the best for you now. And you may be surprised that you may be able to do a different type of yoga in 6 months once you build up some stamina or get better control of your symptoms. So, don't always set those limitations for you. Reevaluate those.
It's great. Do you have any suggestions for how to practice mindfulness during a time where you're constantly on the go and you're being pulled in a lot of directions?
Um, Well, I will tell you transparently that I use mindfulness. I do it throughout my day and I'm not the best at it. So we will learn together, but there are a lot of apps, so smartphone apps that are out there that teach you mindfulness and they actually teach you breathing techniques. So for those individuals that might be a little bit of short of breath sometimes, it does teach you how to do some deep breathing exercises, and they start you off at 10 minutes, 15 minutes, 30 minutes. I'm sorry, 10 seconds, 15 seconds, and 30 seconds. Yes. So these are all options. There are a lot of smart apps out there, but back in the day when apps weren't so popular, I used to actually put on my mirror at work or my computer, remember to stop and take a minute. So I would literally put notes up to remind myself to take a minute to take a deep breath. So that is something very real. There are some aromatherapies. Again, you need to consult to make sure that they're safe for you, they're safe for your respiratory, but other ways to stimulate your senses to do mindfulness. So mindfulness is connecting with a lot of your senses, whether it's touch, whether it's smell, whether it's visualization, stepping out into a garden. Those are all ways to reduce anxiety, stress, depression, and be in the moment.
That's great. So then this question, is mindfulness different than meditation? And if so, can you share the difference?
Well, I do neurology. This is all from like personal experience. And I don't know that I could answer that 100%. If anybody else can, I welcome that. But I think they do overlap to a point. Meditation, I believe, follows different guidelines, whether it's yogi guidelines or the Buddha guidelines. And mindfulness is a technique that you use for a short period of time, but they do somewhat overlap.
Yeah, I think the intent with both of them is to help quiet the mind so that you can get back to a center point and recognize that the mind often wants to take control of us and take us on its own journey. And they're both techniques to help bring it back so that you can ultimately be in control again.
That's a great way to put it. That's perfect. And our mind can take us on some pretty wild journeys, can't they?
Yeah, especially with all the holiday stress.
Mhm.
Well, I think that's it for the questions. I wanted to ask if you had any other just thoughts in general that you could share with our community about looking ahead into the new year, as you were saying, kind of after being able to look beyond the stressful period and into the newness of 2022 and what that will bring.
Um, from a stress standpoint or for an MG standpoint?
Um,
Standpoint.
from an MG standpoint, yeah.
Well, I do happen to know, and hopefully we're waiting very shortly over the next couple weeks and next next couple months that there may be some new medications on the horizon that will get approved. Some new novel therapies that are very exciting for us. So I think that in the MG world, I mean, past 3 years ago, there was about 60 years that we didn't have any new medications. And so this is a great time for you to become and set some goals and become very active in the MG community, because there are going to be some new stuff coming around that you do want to educate yourself on. So educate yourself on some of these new novel therapies that are coming out within the next couple weeks and couple months. Bring them to your provider, make these appointments, see if they're the right medication for you. And I just really cannot stress enough the empowerment in being a patient and doing everything that you can for yourself and bringing those questions to board. Don't compare yourself to anybody else. I truthfully, from the bottom of my heart, believe that we get through every single day by doing the best we can. And so if some days you want to put myasthenia behind you, that's okay. You could turn it off for a day or two and not be as active as you are. But bring it back, turn it back up, right? Bring it up for you and empower yourself. Know what is right, know when it's right for you. And just embrace what is here for you, because there are resources and there are new things coming out.
That's great. How do you have any suggestions for just people who aren't aware of some of the new medications coming out for how they can stay in the know and be aware of when those are approved?
I mean, the one resource that I always refer my patients to is the MGFA. You guys do a phenomenal job of getting top-notch providers around the country to educate, to talk on these things. There's constantly patient programs that are available, even though they're not live right now. They are doing it through Zoom to talk about educating you on myasthenia and medications that might be right for you, and finding out if there is a local support group in your area. And if there's not a local support group, I do know that there's a provider, that there is a caregiver support group through the MGFA, and I think that they have some resources there. So if you don't have one actively in your community, maybe it hasn't been started yet, maybe that's a goal for 2022 for you to start one in your community, but to be part of a support group.
That's great. Thank you. Yeah, and we do have the MGFA has a list of all our support groups online. Because they're virtual now, you can also choose to join one in a different area if there isn't one currently in your local area as well.
Yes.
Well, thank you so much for this presentation. I want to thank everybody for joining us today and for the questions. On behalf of the MGFA, wishing everybody happy, healthy, and safe holidays, and looking forward to more wellness series presentations in 2022.
Thank you. Thank you for all you do. Good luck to everybody. Stay healthy.
Thank you.